This podcast is for general informational, educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Welcome, everybody, to another episode of PHM from Pittsburgh. I am still your host, Dr. Tony Tarchichi. For those of you who are new to us, I'm a Med-Peds trained pediatric hospitalist here at UPMC Children's Hospital of Pittsburgh in the Paul C. Gaffney Division of Pediatric Hospital Medicine. We are now recording episode number 56 on the podcast. If you can believe it, we've gone that far. And it is another episode about COVID, everybody's favorite topic. I know you were just saying to yourself at home or in your car, I haven't heard enough about COVID today, and I'm here to help you with that. So we are going to talk about an article which caused quite a stir, had a wonderful New York Times article written about it, a wonderful editorial written about it, is getting a lot of press, done by some of our own hospitalists here at Pediatric Hospital Medicine, which is a source of pride, and it's very, very well done article. We are here with the lead author. So the article you all know because you've talked about it on the listserv a fair bit. It's Association Between Statewide School Closure and COVID-19 Incidence and Mortality in the U.S. in JAMA. And I am going to introduce, it was published on July 29th this year. I'm going to introduce our expert guest with us. Our expert guest is Dr. Katherine Auger. Dr. Auger is the Associate Chair for Outcomes at Cincinnati Children's Hospital Medical Center. She's an Associate Professor of Pediatrics at the University of Cincinnati College of Medicine and a member of the Division of Pediatric Hospital Medicine. Dr. Auger's research focuses on understanding how policy change impacts children. Her research is funded through a K08 award from the Agency for Healthcare Research and Quality. She completed fellowship training in pediatric hospital medicine at Cincinnati Children's Hospital Medical Center. She also completed the Robert Wood Johnson Clinical Scholars Program, which included completing a Master's of Science degree in Health and Healthcare Research. She has more than 50 peer-reviewed publications, most on pediatric hospitalization and discharge transition. She has received several prestigious research awards, including the Nemours Child Health Services Research Award and the Pediatric Hospital Medicine Outstanding Research Award. So, Kathy, thank you very much for your time. Thank you for joining us today.
Hi, Tony. Thanks so much for having me.
So, before we go any further, this is a CME podcast. Let's do our disclosures. I will go first and then kick it out to you. I have nothing to disclose.
I also have nothing to disclose.
So, where to begin, Kath? This was a great article. It was a good read. It caused quite a stir. I'll ask you first, did you expect the publicity that you got from the paper in terms of the New York Times? CNN talked about it, I think. Did you expect all that?
I will say maybe not so much when we very first put it in. I think we were really excited about this research question and thought it was important. And then as we went through the review process and some of the comments we got back and sort of the approach made us realize that, wow, people are really thinking this is going to make a pretty big news headline. And that's when I think we were really starting to get ready for this.
So take me back. You're sitting in your office or you're sitting at home, and how does this come about? Is this an idea you had? Is this a meeting you all had where we have to do something to help the science here?
Well, actually, it was even more unstructured than that. It wasn't like active brainstorming by any means. The story actually is I went to go pick up my daughter from swim practice, and that was like the same day that the governor had announced that they were going to close schools in Ohio for a couple of weeks just to hopefully let things tamp down and then reopen. And one of the other parents said to me, man, I really hope he knows what he's doing. And I thought, how could anybody know what they're doing at this moment? Like, we have no idea. And there was definitely a sense of, I really want to do something to learn about this. And wow, this is actually something we can know going forward is like, was this the right thing to do? Should we act early with policies? And so the next day, we called up, a bunch of my friends at Cincinnati Children's and said, hey, do you guys want to look at something like this? And it just really snowballed from there. And we put together a team and started working.
Now, how long does a project like this take you all? From start to finish, you have the idea, from starting the data review to submitting for a publication. What time period are you looking at?
Wow. So normally I would say a project, doing some significant primary data collection and then doing all your data cleaning and then, planning your analyses is obviously part of that early in the beginning. And then going through it, running the analyses, writing it up, doing all the revisions and stuff. I mean, that easily takes normally 6 months to 9 months. And in this case, the announcement was made about closing schools the middle of March, and we were able to get a paper out the door by June 1st. And it was really on speed. Like, it was so fast. And we were so fortunate to partner with Troy Richardson and Matt Hall, who are just unbelievably brilliant statisticians, and they worked tirelessly on this. So this really was a labor of love, in the sense that none of us had grants for this. None of us had protected time for this. This was something that we thought was an important public health problem, and that we wanted to try and learn what we could learn as quickly as possible.
I think that's one of the things that got lost in a lot of the discussion on this. Is I have personally on this podcast had about 6 or 7 episodes on COVID. We've reviewed tons of articles. So I think I am able to say that there is not a lot of good information on COVID, and anything that can be done that adds quality information, which is what I think what this paper adds, is helpful. Now, how it affects policy and government decisions, et cetera, is kind of beyond our control, but without better information, anything we're doing is just feeling around in the dark. So let's get into your paper. And I'm going to need your help on this. So now the objective from the paper, from what I have in my notes, is to determine if school closure and its timing were associated with a decreased COVID-19 incidence and mortality. Is that fair?
That is correct. It was, are they doing the right thing, and do they need to do it quickly? Is it something that timing matters? We hypothesized that the earlier you close schools, the more effect it would actually have.
And now you mentioned Troy Richardson and Matt Hall. Matt Hall has been a guest on the podcast, a friend of the podcast, and we know him. They're outstanding statisticians. But because of that, your materials and methods section had some pretty advanced statistics in it and methodologies in it. And I'm not going to lie, I had a hard time. I don't think I fully grasped it. Would you mind walking us through it?
Absolutely. You're right. I mean, it is really complicated. And I'll just mention beyond Troy and Matt, we also partnered with David Hartley, who is an epidemiologist who his expertise is in influenza-like illness. So you can imagine, like, when coronavirus hit, he was really well poised for this. So he also had done a lot of modeling and thinking about infectious disease. And so we had all of those experts sort of at the table, both content-wise and statistically as well. So, right. Think about basic regression. Regression is when you draw a line through something and see whether or not there's a correlation in a linear fashion. And in this case, we were looking at time. So the amount of time from school closure and going forward to see whether or not there was an association with the number of cases and deaths from COVID, right? So think about time as sort of your x-axis. What then we did is we know that when you're modeling COVID, it's actually not a line, right? It in its uncontrolled state, it's actually exponential. So we were able to use mathematical modeling over time to look at that exponential growth when it was sort of unfettered, I guess, or uncontrolled, and then be able to model a breakpoint to say, this is when we think school closure effect would come into place. And does the line still increase at that exponential rate, in which case you would say, oh, school closure didn't do anything, or does it change in some way? And so what you can see from our figures is you have this sort of exponential growth up until a time point, and then there's a change in the slope. And that change in that trajectory of that line is what we were modeling, and how big was it. And then we spent a lot of time talking with the editors about JAMA, is like, initially we had presented only the relative change. So let's say this is the modeled incident, like how much COVID there would be if schools hadn't closed, and then compare them to what happened with school closure. And we initially presented the relative change, so a percentage of difference of cases. And JAMA really pushed us to make sure that we were presenting absolute changes, so actually giving us population rates. So some of the mathematical complexity is in sort of that translation from a percent to an absolute. The other thing that makes it complex, right, is we know that correlations, like a bivariate correlation, so if you're just comparing two things, that's just part of the story. We also know that other things were happening at the time. So states were closing other things like restaurants, and they were closing businesses, and they were doing gathering bans, and they had stay-at-home orders. So those four policies we needed to account for as what we call time varying covariates in the model. So that way, on the day that, say, New York put forward a stay-at-home order, we were accounting for it at the right place in the model. We put into the model things like how many obese individuals were there in the state, because we know that obesity is a risk factor for COVID mortality. We put in things like the social vulnerability index, which is a measure of how prepared a state would be based on their poverty levels to handle something like COVID. So there was a lot of things that we put into this model. As a matter of fact, we wanted to put so many different factors in because we weren't sure which ones really, truly, absolutely mattered. We used a technique called stepwise regression. And basically what that does is it allows the model to select which covariates are the most important, and it keeps those covariates in the model. And then if there's a covariate that's not important, it's excluded from the model.
So that's how you were able to put in the covariates, but then isolate out for simply the school closing order as the stepwise regression you were just talking about.
Yes, the school closure was the primary predictor. So that was the one that we were focused on, and we were basically adjusting for these other things. I think this is, well, I could say so much.
We have time.
I mean, I think one thing that we did slightly differently than some other papers that have looked at sort of policy implications broadly is that we really focused on school closure, and that was our primary predictor. So if you think back to the way things were last spring, not all states closed schools on the same day. So we actually lined it all up and made our sort of start day zero as the day that schools were closed in the states. So all the states, basically, it was almost like all the states artificially closed their school on the same day. So we could find the association with school closure because they were all lined up. I think some of the other policy papers that are out there evaluating various effects of other policies is they don't line them up. So I think that's why you see slightly different results when you compare study to study, is because we were really focused on school closure in and of itself.
And can you give me the reasoning behind the state quartiles? You put them, you categorized them in.
Great question. So what I said at the beginning is we were looking at both whether or not closing schools mattered, but also if the timing mattered, right? So we use these quartiles as a marker of when a state closed their schools. So some states like Ohio, West Virginia, they closed their schools so early that the number of cases in that state were like almost zero. They were very, very, very low. Other states like California, certainly New York and Washington, their outbreaks had already progressed quite a bit further when they closed their schools. So we used the number of cases that a state had to determine whether they were an early closer or a late closure. And we ended up examining it in terms of quartiles based on the number of cases on the day that the state closed their schools. So the lowest quartile are states that closed their schools really early, and then the highest quartile are the states that waited and closed their schools later in the epidemic.
Now, in terms of statistics and the math behind it, tell me if what I'm about to say is correct. There is no perfect way to rule out everything else that was done at the same time as school closures, like stay-at-home orders and banning the bars and restaurants. But do you all feel that what you did is as close as you can get and as accurate as you can get to really isolating out that stay-at-home order statistically?
Absolutely. I would actually tweak that just a tiny bit and say, I feel a little bit more confident in our ability to separate out, say, school closure from home, stay-at-home order, or school closure from restaurant, because we were able to look at those things in the model, but it's the synergy that is challenging to capture, right? So whatever synergy exists between closing schools and having a stay-at-home order, like those interactions are really challenging to model. Other things that are challenging to model, as you remember, different public health advisories went into place at different times. So things like in the beginning of the study, there really were no masks, and masks probably didn't pick up until actually pretty late in the study. But those sorts of things are hard to, like, how often did someone wear a mask is impossible to know because we just don't have a measure of that. How often did someone wash their hands? The sort of individual behaviors, those are impossible to separate out from school closure.
All right. So let's get into some of your results. You know what? Well, the first sentence in your results section, I read that, and I must have read it 4 times because it was hard to believe from 10 days, there is so much data. And really, you looked at the states closing between March 13th and March 23rd of 2020, and yet it just really brings on so much data. Now, your cumulative incidence, and I had to look that up because I wanted to make sure I understood that term, because you guys use it a fair bit. And from what I understand, it's a measure of frequency, like a measure of disease frequency just during a period of time. Is that right?
Right. So, okay, cumulative incidence was how, when we go back and talk about how many cases did they have on the day that schools closed, that is their cumulative incidence. And cumulative meaning from the very beginning of the pandemic until the day that they closed schools, how many cases did they have? And that's their cumulative incidence. Then you have to separate that out from daily incidence, which would be the number of new cases per day. So our predictor, one of the things we were interested in was how many cases had they had up until the day that they closed schools. That's cumulative incidence. But then our outcome is how many new cases are they having on a daily basis. So that is super confusing.
The first table you guys have, it's 2 pages long, and it's really what we talked about in terms of state characteristics. And then you get into figure 1, which is your observed daily COVID-19 incidence and mortality by cumulative incidence quartile, the time of school closure. And it's really day 0 is when the schools were closed, the first set of schools. And then you're looking at all the graphs. What struck me is I've never seen graphs like this in these shapes. I mean, they're just oblong shaped. There's rectangles and squares in the middle of them. It's just up and down from when schools were closed. So that was odd to me. But then looking at your table 2,
Tony, let's talk about figure 1 first.
Good.
Okay. All right. So figure 1, what you're looking at is the number of cases, and then in the first panel, and then the number of deaths in the second panel. And each line on there is an individual state. So some of that jig-jaggedy type stuff that you're seeing is because, again, these are actually pretty low numbers, because if you think this is pretty early in the pandemic, the number of new cases in each state was jumping around quite a bit. So why you see some of that jig-jaggedy is there. The things to pay attention to in this figure, so you'll note across the x-axis is time. And so you're right, you're absolutely right. Day 0 is the day that that the state closed schools. And I already told you, we lined every state up. So that is the day that all the states closed schools. And then what you're seeing is this sort of general increase until what we call the end of the lag period. And then after that, you're seeing sort of a flattening. So I'll talk about the lag period first, and then I'll talk about the different colors on here. So the lag period is something that you use in time series analyses to account for the fact that when you change a policy, you wouldn't expect to change tomorrow. This is particularly true of something like COVID, but let's take a step back. Let's say you wanted to study whether or not the effect of a new vaccine made a difference in the number of hospitalizations there is for that vaccine, right? Or for that, for whatever that illness is that the vaccine prevents, right? So if the vaccine is released on January 1st, you wouldn't necessarily start looking for an effect on the hospitalization rates from that vaccine on January 2nd. You know it's going to take time for the vaccine to be distributed, for people to say, oh yes, I really do want this, for people to actually start using the vaccine, and then finally get to a point where you think, okay, enough people have been vaccinated that we might actually see a difference in the number of hospitalizations. So you know that there's a time lag from when a policy can change to when you might see an effect. So with this case, we know that there was an amount of time that would take from when a governor says, okay, you have to close the schools tomorrow, and now everyone is out of schools, but that wouldn't change your number of COVID cases tomorrow. It would take a little bit of time, because we know that first someone has to get sick, and then they have to spread it to someone else, and then they have to get tested and be diagnosed. And you have to remember that early in the epidemic, there wasn't a lot of testing. So we built in this time lag where we said it would take a few days for someone to get sick, and then it would take even more days for them to get tested. And actually, because early in the epidemic, probably the only way you're going to get tested would actually be hospitalized, we said it would take that much amount of time from your symptoms onset to the time hospitalization. And that's how much time it would take for diagnosis early on. So that's how we built the time lag for cases. For deaths, it was even a little bit more tricky to tease out, because there wasn't a lot of great data that says if you catch COVID, or if you first develop symptoms from coronavirus on this day, how many days are you before you die? Because there hadn't been a lot of natural studies, but we looked at the control arm of some of the large drug trials and tried to model out for people who die, and sort of put together different information from different studies. For people who die, this is about the amount of time it takes from the time you start having symptoms to the time you die. And that's how we developed the time lag for death. So there are time lags in both of these analyses, and those time lags were used for all policies, not just school closure, but also policies such as restaurant closure, business closure, etc., because we knew it would take a minute for those things to take effect. So back to figure 1, you're seeing, again, all the states lined up at day 0 when they close their schools, but you see that there's some spread at day 0 as to how many different cases that they had when they closed their schools. And so the lowest quartile have the lowest number on day 0, second lowest quartile have the second lowest numbers on day 0. The second highest quartile has the sort of third lowest numbers on day 0, and then the highest quartile has the highest numbers on day 0. So you can really see that's where the quartiles are, and then you can follow the trajectories of those states going forward, and you can see that there's more increase in that highest quartile before the end of the lag, and then what happens. So this is just a way of visualizing what's happening before we expect to find changes with any school closure, and then what's happening after when you expect to see any changes if they existed.
That was a fantastic explanation, which I could not have done well at all. So I appreciate that a lot.
Thank you.
Now, Kathy, let's move right along in your paper. Table 2, and this is where I started having more trouble following the explanation in the paper. And again, I felt that the writing, there wasn't a wasted word in your document at all. I mean, and sometimes when I read papers for the podcast, there's filler sometimes when people are writing. We were the first to do this study. This was the first thing to happen. There's some of that. There was none. If you look at my paper, I've underlined and highlighted like everything. So I thought it was really well written. But can you walk me through Table 2 in terms of the COVID-19 incidence and mortality and effect size associated with school closure?
Sure. I think that Table 2 is chock full of information, and I think that's what you're probably reacting to. But the Table 2 is sort of where the meat of the paper is. You know, in that first column, we look at all states. And this is sort of the average effect over all 50 states. And then the 4 columns to the right are based on that lowest, second highest quartile that we've been talking about. It's the number of cases that they had when they closed school. So I think if you can understand the all states and understand that column, then you can look to the right and say, okay, well, that's what it was for that lowest quartile, and that's what it was for the second lowest, et cetera. So again, like some of this process when you're writing a paper, you submit something, and then of course the reviewers and the editors come back to you and say, hey, can you tweak this? Can you make this more understandable? And it makes it ultimately a much better paper. One thing that JAMA had asked us for was sort of to include the observed as well as the unadjusted, so sort of that bivariate comparison, as well as the adjusted. So that's why you're seeing so many different lines here. So the overall new cases per 100,000 residents is the observed number of cases. That's just how many cases there were. And that is broken down into the period before school closure. So like, again, it's really probably more correct to say the period before you would expect any effect of school closure. So it was during that lag period. If you think back to the figure, it's that initial 16 days. And then there's the period after school closure. That's when you expect to see any effects associated with school closure, if there are any. So that's 17 to 42 days. And so that first line, overall new cases per 100,000, is the observed number of cases in the United States for the first 16 days, and the observed number of cases from days 17 to 42 per 100,000. So the next line, we wanted to give a sense of how much did it vary state by state. So the next line is the number of cases per state in that time period that was with the medium and interquartile range. So that means that the median number of cases in that sort of lag period was 19 per state. So 19 per 100,000 in sort of the median state. But there's an interquartile range. So you can see it's pretty wide, actually, 17 versus all the way up to 52. So there's a lot of variability state to state. And really that second line about the number of cases per state per 100,000 residents is all about how much variability there was in the states. So that's, again, those two lines are just observed. The next is where you're actually starting to see some of our modeling coming in. So you'll see that there's the unadjusted relative change per week, and that is given as a percent. And that number 220 shows that there's a 220% increase per week in that lag period. So it sort of gives you a sense of that curve that's going up, that the number of cases are going up before the effect of school closure. So from day 1 to 16, the number of cases are going up, and that's just unadjusted for anything else. And then we wanted to adjust that for based on all those characteristics that we talked about. So the composite adjusted relative change per week is the increase that is overall increase based on the adjusted characteristics of the models for that school period. So that's the pre-period. The post-period, again, I already talked about, so this would be the day 17 to 42 is the post-period, which is when you would expect to see any effects associated with school closure. So I already talked about the overall new cases per 100,000 residents is just how many we actually saw in the United States. The number of new cases per 100,000 residents per state gives you a sense of how much variability there is within the state. So those are both observed. And then you get to the composite adjusted relative change per week, and you see a number 10. That means that overall, in all 50 states, that post-period, there was still a 10% increase in the number of cases per week. So again, it's relative increase, but it's a slight increase in the overall rate of what's happening with COVID after schools close. But that's everything. That's accounting for things like restaurant closures and school closures and gathering bans. That's overall. That doesn't tell you how much of it is actually about the school in particular. Mm-hmm. So that next line, the relative change per week associated with school closure, tells you how much of that decrease from 220% increase to only the 10% after that change, how much of that is related to the school closure itself. And so that's the main sort of finding. It's 62%, negative 62%. So that means it's a decrease in 62% of cases per week associated with school closure itself and not associated with anything else. And that is an adjusted number when you account for all the model.
You got that number by using stepwise regression?
Mm-hmm. The stepwise regression. So again, we talked about this is our primary predictor. We have sort of an overall effect from everything, all the factors that we accounted for, and then we are able to look at just the primary predictor, and that is our primary predictor, so school closure in and of itself.
That's very helpful, because that what confused me reading it is the composite adjusted and then the relative change unadjusted and adjusted. I wasn't understanding what they represented no matter how many times I read it. And I think that's my fault more than anything else. But that was a very nice explanation.
I would say it's super confusing, right? Thank you. When you lock down to figure 2 and you are looking at sort of let's look at figure 2, panel A. Okay. That you can compare the numbers in table 2 to this figure 2. So days 0 to 16, that slope of 220% increase per week, that is that exponential slope that you're seeing there, right? So that's an increase of 220% per week in that sort of pre-lag period. But then the post-lag period, you can see it's pretty much a flat line. That's that composite post-lag 10% relative change per week. So you can see those numbers in the figures, and 10% is so minor compared to 220. It looks pretty darn flat. But what's harder to see is that negative 64%, because it's just a part of the whole. And so it's really only with the mathematical modeling that you can pull out that isolated effect from school closure.
Now, is there even if for future years, God forbid another pandemic ever hits us, there is no other way to account for these things. There's no prospective way to do this. This kind of retrospective review and statistical modeling and pulling the data out is really the best we're going to have to look at should we ever get another COVID kind of thing. Am I right in saying that?
Yeah, I agree with you. As a matter of fact, I think we were as prospectively retrospective as you could be, right? So, and I mean, we actually had a little bit of a discussion on our analysis team is whether or not this was really a retrospective study or a prospective study, because we started looking for state policies basically the week that they started implementing state policies. So we were collecting state policies, every week We had a big study team that was going to websites, and we had 2 reviewers for each website. And then, if there was any confusion, we would discuss them as a team. So we sort of did this prospective data collection that was right at the beginning of the pandemic. And then, of course, these numbers were being collected. We used Johns Hopkins data for cases and deaths. So they were being released sort of ongoing as well. And so we had this discussion, is this prospective or is it retrospective? And ultimately we decided it was still technically retrospective because we made the research question sort of as this whole thing was happening. And it wasn't like, we didn't have this discussion in February that said, hey, if they start closing schools in March, should we start studying it? We didn't do that. We did it sort of on the fly. So I think this is as prospective, retrospective as you can get.
And I will say it is a testament also to Johns Hopkins, because that database is so rich that you're able to pull this much out from a publicly available database. It's really impressive on their part.
Yes, it is incredible how quickly they got the data out, because the other thing that's easy to forget is at this time, some of the original numbers coming out of the CDC were still delayed and they were harder to follow. And so the Johns Hopkins data was definitely a very important source for us.
Now, would you mind, we have, I think 1 or 2 more tables left, table 3 and 4. Would you mind talking about table 3?
Yeah, so table 3 is basically table 2, except instead of being relative percent change, we actually tried to put some rates, absolute rates in here. Now, there is something you have to know. One other part of the methods that we didn't talk about previously that you have to understand in order to understand table 3. When we were trying to make estimates about absolute changes and what might have happened if they had kept schools open compared to what did happen when they closed schools, we recognized we would have to make some assumptions about what would have happened with the coronavirus had these policies not been implemented, right? And we had a lot of anxieties of it as a team to think that the exponential growth that we saw early in the pandemic, whether that would go on forever, and to think that that exponential curve would continue for a full 6 weeks, that would be a lot of cases. And we thought that it was unrealistic that there was any scenario in which people wouldn't start totally changing their behavior, keeping their kids home from school voluntarily, avoiding restaurants, and et cetera. So we thought it was unrealistic to compare what happened with school closures to a scenario where if schools had remained open, that coronavirus would have just continued to spread exponentially. So that's not what we did. We did sort of do it because that is like the most typical thing to do in a time series analysis, is just continue your curve exactly as it is and see what happens. Those numbers are in the appendix. They're a little bit ridiculous, as you can imagine, because again, we don't think that coronavirus would have continued at an exponential rate forever. So instead, what we did was we tried to do something that was both realistic and sort of conservative. So a realistic conservative approach where we allowed that exponential growth early in the pandemic, which everyone saw. And then at the end of our lag period, so day 16 for cases, day 26 for mortality, instead of allowing it to grow exponentially, we said, let's just draw a line at that point, and we'll make the slope of the line whatever the slope was of the curve at that moment. So for those people who love calculus, basically it's the derivative of the line at the end of the lag period. And we thought that that was a reasonable approach because we also had done some comparisons of what the numbers would have been with a linear projection like that to what things were in the outbreak in July. And we saw numbers that were very similar. So we didn't feel like we were giving rates of coronavirus disease that were a lot higher than you could ever see in the world. So using that line, so using your initial exponential curve and then turning it into a line at the end of the lag period, we then had this sort of projected estimated account of how many cases there would have been had schools not closed, and then how many deaths there would have been had schools not closed. And we compared those rates of numbers of cases and deaths to the numbers of modeled cases and deaths with school closure. So that's the comparison. And so in looking at table 3, table 3 is just the number of cases. And we're talking about that pre-lag period and the post-lag period. So if schools had remained open, you would have expected 37 cases per 100,000 in that first 16 days. And then if schools had remained open, after that lag period, you would have expected 638.7 cases per 100,000 based on that line. Okay, that's with schools remaining open. With school closures, again, that lag period, the number of cases in the first 16 days is exactly the same because it's the same line or same exponential curve, 37 cases per 100,000 over a 16-day period. But what's different is once you account for school closures, you see a modeled incidence of 214.8 cases per 100,000 from day 17 to 42. So then you just compare that 638.7 minus the 214.8, and you get a total difference of 423.9 cases per 100,000 from that day 17 to 42. So the 16 days, that's 26 days. The 26 days after you see the effects of school closures, you see a difference of 423.9 cases per 100,000 associated with the effect of school closure. So that's how you can put into sort of an absolute difference the effect of school closure.
And when you say associated with, you mean you've removed out the other categorical variables like the restaurant closure, et cetera. And this is, you think, purely due, as purely as you can be, or as sure as you can be, due to just school closure.
Correct. And you said that beautifully. As much as we possibly can mathematically, isolating out the school closure, it is just the school closure. It is accounting for the other policy implementations and the other factors that we had in the model.
Okay. And then you go through for the lowest, second highest, and highest quartiles and go through each of those state groups you created.
Correct. And I'll just say one other thing about the lowest, second highest, and highest. You can see the very last line of the table, it's actually comparing sort of horizontally. So instead of comparing what would have happened if schools hadn't closed potentially to what did happen with school closures, we actually are comparing those states that closed their schools early when the cumulative incidence was very low compared to the states that closed their school later when the cumulative incidence is higher. And you can see that in that 26-day period from day 17 to day 42, those states who closed their schools earliest in the lowest quartile, they had 128.7 cases per 100,000 fewer than the states who closed their schools latest.
Yeah, that surprised me, and I guess it shouldn't have, because you're already up that exponential growth. You have that first 16 days still. If you're starting at a much lower number, you're going to end up at a much lower number if school closures help stop virus spread, which it seems like it does.
Correct. You're absolutely right. It has a lot to do with what's happening very early. Like once you already had a bunch of cases in your community, and when I say a bunch, it actually isn't a bunch by today's standards, but a bunch by those days' standards, then your growth of coronavirus was up much, much quickly because it is exponential.
I'm curious, and I can edit this out if what I'm about to say makes no sense, but there was a science paper we reviewed in the last podcast that discussed this similar topic, not exactly the same, using very advanced mathematics that I could not really understand. But they used what they had found in the primary cities, I believe, were Shanghai and one other city in China, and they found that it was the mix, and they looked at school closures and found roughly the same thing, that school closures significantly helped stop the pandemic spread. And their thesis, or their hypothesis and their finding, was that it was the mixing between the ages. The fact that you have younger kids mixing with older kids mixing with adults And in previous studies we've looked at, they showed how much more people kids come in contact with in school versus adults do in their normal jobs. It's just an astronomical difference. Did you guys look at that when it came out and see if it made sense what you were doing?
I think I know what paper you're talking about, and I certainly remember reading it but I think one thing that has been interesting, sort of looking at the kids spread literature, is it's like there's some growing evidence that the younger kids probably don't spread as much as the older kids. But the thing about kids is that they touch so many different people, the number of contacts that they have, in a way, it may wash out the fact that they're not quite as efficient spreaders. I know you guys just had I listened to that podcast and I didn't finish the last 7 minutes. So I'm now wishing I had gotten all the way through. It was an awesome podcast. I really enjoyed it.
Thank you.
I'm like, no.
Now we only have one more table left in your paper, and then we'll talk a little bit about the editorial, and we'll get you out of here. The estimated absolute differences, and I like this one, in COVID death between school closure and schools remaining open using linear projection. Now, right away, that title's going to scare people.
Fair enough. So table 4 is basically table 3, except instead of cases, it's deaths. So if you can make it through table 3, you can make it through table 4. But table 4 is, again, using that same linear projection, using the derivative of the curve at the end of the lag period. And you have to remember, for mortality, we use a longer lag period, so 26 days. And so it's just looking at, in that initial lag period, days 1 through 26, there were 3.2 deaths per 100,000. And that is true regardless if you're thinking about the scenario when schools would have remained open or the scenario where all the schools closed. And then the sort of after the lag period, days 27 through 42. Now this is only a 16-day period. You have a projected number of deaths of 19.4 if schools had remained open, compared with a modeled number of deaths of 6.8 per 100,000 with school closure. So that the difference in deaths in that period from day 27 to day 42 associated with school closure, the difference in deaths is 12.6 per 100,000.
And that's a very good number.
Yes. So in the discussion, we do take those absolute rates out to population estimates for the United States. And what we say is that those differences associated with school closure would translate into 1.37 million fewer cases of COVID-19 over that 26-day period. So you remember that's day 17 through 42. And then a total of 40,600 fewer deaths over the 16-day period. And that's day 27 through 42. So they are big numbers.
They are big numbers. And I really, again, I've said openly on the podcast, I didn't quite understand all those statistics. I mean, this was in terms of really dissecting it out. I believed the results, and I really think this adds a necessary element, because we have to at least be able to study and come up with a reasonable understanding of what the interventions we're doing, what are the effects. And we can look at the blowback, the unintended consequences, which the editorial written by Pittsburgh's own Doctors Julie Donahue and Elizabeth Miller discussed beautifully an editorial on this paper, and they really went into it in terms of the inequity in school districts from poorer socioeconomic status to higher, the inequity along racial lines for Black students, and another paper just came out showing that Black children are the ones primarily getting MISC and the bad effects from COVID. And and the issues with how schools have food for kids, a lot of services in terms of physical therapy, occupational therapy, speech, mental health services for children. They get them a lot at school, and without them, what will happen? Schools are places where kids will be reported for child abuse if teachers see things, are one of the primary reporters. All of that's true, and I think that's where a lot of the listserv discussion was, looking at everything. But we need data like this to at least understand what we're doing.
No, I agree, Tony. I think one of the reactions that I experienced frequently, and it didn't surprise me, but still made me very thoughtful about this experience, was I think people assumed that I, looking at this and finding these results, it made me anti-school, or it made me people assumed that I believe that we should never reopen schools again, because those are big numbers and they're scary numbers.
Right.
And yet that's not what you can conclude from this paper. What this paper is talking about is what happened when you closed schools last spring, and what the effects associated and how much change associated with closing schools last spring. We've learned a lot since last spring. We've learned about masks. We've learned more about our social distancing. We're still have more to learn about kid-to-kid transmission, how kids are spreaders in this illness. So it is not to just assume that because schools closed, and probably closing schools was effective in some sense, that you should just never reopen schools because of all the things you just listed. Schools are incredibly important for our society, both in terms of education of children, providing services to children, providing social supports for families, providing meals to kids. Schools are vital to this infrastructure. So if I had to say, what does this paper actually mean for reopening or for school policy in the future, I would say three things. One is, based on that quartile discussion we had, that the number of cases in the community should be part of the equation when you're thinking about school reopening, because we do think that the number of cases in the community is going to be associated with how many cases potentially could be in the future. And that's what the AAP says, that's what the CDC says. So that's not it shouldn't be seen as particularly controversial, and I don't think it is. The second is to remember that this, again, was before we had masks and before we had sort of all of our knowledge that we have now. So it is to say that schools shouldn't reopen back in the old normal way, because what we modeled was the old normal. And if we go back to that old normal, we may very well see some of those changes in the number of cases in the community and in deaths. So the old normal is what we were looking at mathematically. You can't really make inferences about what happens when you open schools if everyone's wearing a mask, if there are now 3 to 6 feet between your desks. So new research needs to be done now as schools are reopening and looking at what factors schools are taking to protect children and which are the most important and how that interplays in the community. And then the third thing, though, and this is probably where I think people have the most anxiety, is that while I hope we are not in the middle of a huge outbreak this winter, as viruses tend to circulate more in the winter, while I hope we are not in a dire situation where we are desperate for some intervention, if, however, we ever got into a dire situation, closing schools would potentially help bring down the epidemic again. And again, I hope that never happens, but that would be potentially an effective intervention that could be done from a policy standpoint.
And going back to other pandemics, it has been done in the past. Swine flu in New York. I was a resident in Newark, New Jersey, and they shut down schools in New York to really get a control over swine flu. That was for a week. Clearly, this is different and this is longer, but we know it works. Is there anything we did not talk about that you wanted us to just talk about?
All right, Tony, this was such a thorough discussion. One of the other big questions that we've gotten is, how do we know that any effects associated with school closures is actually about the kids and the kid-to-kid transmission? Because we know that child transmission is probably different than adult transmission. And this is something we actually spoke a lot about as a research team early on in the analysis phase of our work. And ultimately, we decided that there was no way to separate out how much of any school closure effects were related to kid-to-kid transmission or kid-to-teacher transmission versus parents no longer being able to go to work and staying at home. And ultimately, we decided that that was actually all of those disruptions from society are part of school closure. So it may be that a good chunk or even a majority of the effects of closing schools is actually due to the disruption of parents' schedules and parents no longer being able to go to work, etc. But ultimately, when you implement a policy like closing schools, all of the sort of societal impacts come into play. So there was no way for us to figure that out from our analysis, but it really kind of is a whole package of, disrupting kid-to-kid transmission, disrupting kid-to-adult transmission, and also disrupting parents' works and their transmissions as well.
I wanted to say I really appreciated you and your colleagues at Cincinnati Children's and, of course, Matt Hall and Troy for doing this, because it really added a lot to the literature and a discussion around how kids function as spreaders and how schools function as spreading sources. So I really appreciate the work you all put into this.
Thank you so much. It was really fun to talk through it, and it is complicated, so yes. I'm glad I got a chance to chat through it with you.
Now, before I let you go, there is a tradition we have at PHM from Pittsburgh that we cannot let you go until you do it. I don't know if you've ever heard of it before, but it is a corny joke segment. I don't know if the episodes you heard, you found it, but we have a corny joke segment that we do here. And I'm about to give you a joke now that I have not used in the past. Why did the Clydesdale give the pony a glass of water?
I don't know.
Because he was a little horse.
I
do love them. Okay. Kathy, I really appreciate your time.
One of the really great things about this project, in addition to what we think was important public health work and being a part of that, but it was also sort of the building of a strong team and really being a part of something that was really special. So I really want to give a shout out to my colleagues at Cincinnati Children's who helped drive this and were working tirelessly about this. So Samir Shah, Amanda Shondameyer, Joanna Thompson, and Pat Brady. It was really an awesome team from Cincinnati Children's, but then we also, again, got to partner with David Hartley, that epidemiologist who was brilliant, as well as our partners from CHA, Matt Hall and Troy Richardson, with a very, very, very special shout out to Troy Richardson, who I know worked countless hours, evenings, and weekends to get this out. So thanks to everyone on the team.
Well, that's great. And I should give my thanks as well. Thank you all very much.
Thank you very much.
Thank you for your time. Thank you for everything. I really appreciate it.
All right. Have a great day.
Time for our acknowledgments. I want to thank our special guest again. I really do appreciate your time. I want to, as always, thank the UPMC Children's Hospital of Pittsburgh and specifically the Paul C. Gaffney Division of Pediatric Hospital Medicine for continuing to support the podcast. I want to take the time to remind our listeners that there is CME associated with most of our podcast episodes, courtesy of the University of Pittsburgh. So thank you, University of Pittsburgh. Please just click on the link at the bottom of the podcast, takes you to a web page, create a free username and password, answer some questions that I write that are not hard, and that's it. You get AMA Category 1 CME credit. I want to, as always, thank and acknowledge Dr. Megan Keene Tarchichi, who helps me with everything. But I really want to thank you all who are listening. Thank you for letting me come into your earbuds or your car, wherever it is you are. I really appreciate the fact that you do that. If there's anything you want to hear or think we can cover better, any comments, suggestions, compliments, whatever you want to do, again, as always, please feel free to email me at Tony, Tony.Tarchichi, Tarchichi, @chp.edu. Thank you again, everybody. I hope you have a great day. We'll see you next time.
Thank you for listening.